The synchronization process, though, basically involves each woman coming on their menstrual period, at which point they would start oral contraceptive pills and would be on those approximately 3 or 4 weeks until each woman had started the pills, and basically we are suppressing each of their ovarian functions so that we can control each side of the equation, and we would then stimulate the egg donor with injectable gonadotropins, which are in small needles, kind of like an insulin syringe, and they would do 1 or 2 shots a day for approximately 10 days while they undergo some ultrasound monitoring and some lab draws to see how their stimulation is going. And when we get to a point where we would feel that if we do a transvaginal egg retrieval under IV sedation, that we would have the best chance to get the most number of mature eggs, we would do that at that point. During the time that the egg donor is undergoing the stimulation, the recipient is at the same time having her uterus primed to be able to accept the embryo. 3 to 5 days after the eggs are retrieved, they could be transferred into the woman's uterus. And what happens on the day of the retrieval is the patient's partner, or if donor sperm is needed, is used to fertilize the eggs that are obtained at the egg retrieval, and that is done in 1 of 2 ways: either standard insemination, where the eggs and sperm are put together in a petri dish and are left in the incubator and would fertilize very similar to how they might in the fallopian tube, or another more advanced technology called ICSI, ICSI, or intracytoplasmic sperm injection, is used to actually insert 1 sperm into each mature egg, and then you look the next morning and see which ones fertilize. And that technique is good if there are male factor issues in the fertility, such as a low sperm count or poor movement or lower numbers of normal shaped sperm. Once we get the fertilization, we do follow the embryos for 3 to 5 days, which allows time to hopefully grow out to the blastocyst stage, which is an advanced stage of development of an embryo. And some of the embryos will kind of deselect themselves by not progressing, and then you would not transfer those, but you want to pick the ones that look the best on the 5th day, and ideally we transfer 2 embryos into the recipient's uterus. Hopefully 12 days later they would have a positive pregnancy test, and we would follow them like any one of our other patients in an early pregnancy situation with some labs to make sure that the quantitative beta HCG or pregnancy hormone is rising appropriately, and then about 4 or 5 weeks after the transfer, look with an ultrasound to see do we have 1 baby or 2, can we see a heartbeat, all the things that they want to know at that point.